Good evening, everybody, and welcome to another edition of the South Florida Tribune podcast. My name is Scott Morgan, Rock the Motor City Madmouth. I am joined by Gary Kornbluh and Candy Ebling. And first of all, just so you know, the South Florida Tribune podcast is presented by Senior Medical Associates, the leaders in senior healthcare coverage. And Gary Kornbluh, why don't you give everybody an introduction about who you are?
Okay, hi everybody. I'm Gary Kornbluh. I am a career insurance agent specializing in health insurance and Medicare. I've been awarded the Elite Circle of Champions Award from the Department of Health and Human Services 4 years in a row, so I'm proud of that. Proud of just helping the folks and really offering terrific guidance. Medicare is really my specialty, and 32 years in the business, so I'm pretty knowledgeable.
All right, well, just so you know, folks, tonight's episode focuses on Medicare open enrollment. So with that said, we're going to get right to it. So first of all, Gary, what is the best Medicare policy?
Best Medicare policy. Okay, that's a good question. That I seem to get that question all the time. So the best Medicare policy really is the plan that most of your doctors take. So now that could be Medicare Advantage, it could be Medicare Supplement, and we can get into the differences between the two. But basically the best policy is the one where all or most of your doctors accept the plan, because people really don't like to change their doctors. They've been going to them for years and they're comfortable with them. It's a very kind of a personal relationship. And most people have that nice personal relationship with their primary care physician, as well as, some of their specialists.
Yeah, I'll tell you, I'm one of those individuals that doesn't like to change doctors either. And I got to tell you a funny story. A long time ago, many years ago, I hated to change hairstylist because I wanted, once upon a time when I had a lot more hair, I was very picky about who cut my head, but cut my head, hair, all that stuff, because you didn't know if you had a real sloppy student cutting your head. All kidding aside, okay. But when it comes to doctors, that's a very, very sensitive issue. And I know that a lot of folks are very reluctant to do that. So I can completely understand and relate to what you're talking about there. So with that said, Gary, what is the difference between a Medicare supplement and a Medicare Advantage plan?
Medicare okay. So the difference is a Medicare supplement plan is usually a Medicare recipient's best choice. And the reason why, and as long as it's affordable. So Medicare supplement is where you've got original Medicare parts A and B, and you're purchasing a policy issued by a private carrier, and they supplement the Medicare A and B, because Medicare A and B typically covers 80%. There's the gap, right, that people talk about. That's why it's sometimes referred to as a Medigap policy. And then, so that private policy covers that 20% and basically gives the recipient 100% coverage. And there are many different Medicare supplement plans, and they're somewhat different. And people have different needs, can have different budget. So it's really whatever meets your needs and your budget. But that's Medicare, original Medicare, and a supplement. So that's what a supplement is. Now, if you go that route, you've got access to the entire Medicare system nationwide, doctors, specialists, hospitals. So again, that's why it's always your best choice. If you go that route, if you take original Medicare and the supplement, you do have to buy what's called a standalone Part D plan. That's going to cover your prescription medications. Okay. Now that option, I call that option A, and Medicare Advantage option B. Option A is going to cost you money. Now, the Medicare recipient's going to have to pay their Medicare Part B premium, regardless of whether they go with original Medicare and a supplement or Medicare Advantage. But the Medicare Advantage plan doesn't charge an additional premium, whereas the Medicare supplement carries a premium. as does the Medicare Part D to cover the prescription medications. So again, Medicare Advantage or option B, your only responsibility as a Medicare recipient is just to pay the Medicare Part B premium, because there's a zero plan premium on most Medicare Advantage plans. Plus, the other benefit is you get the ancillary coverages too, like you get dental, vision, and hearing as well. So sometimes people refer to the Medicare Advantage plan as a Part C, and I always tell my clients the formula is really, Part A, B, and D equal the Part C, or you could do it the reverse. C equals A, B, and D, right? Because your Part C, or the Medicare Advantage, includes your Part A, your Part B, and your prescription meds.
Now we'll get into the dental and vision coverage very shortly. Okay, Candy.
So Gary, before I get into one of my questions, I want to what age are we talking is for Medicare?
Okay.
What age group?
Okay, that's again another great question. So the age really is typically it's 65. So when you turn 65, you're said to have aged into Medicare.
Okay.
So now, can you qualify for Medicare prior to age 65? Yes, you can. Many people that are on disability that collect SSDI payments, once you've collected disability for 24 months, you automatically become eligible for Medicare Part A and Part B, even if you're not 65 yet.
Okay. Good.
So it's, people that are on disability, as long as you have a Medicare card, a red, white, and blue card, as we call it, you're eligible for Medicare Supplement or Medicare Advantage. Now, we could get really into the weeds with that, but I'll just say people that are on disability usually want to take a Medicare Advantage plan until they turn 65, because the premiums for Medicare Supplement plans when you're on disability are very, very high. It could be $700, $800 a month just for the supplement. Whereas once they turn 65, they'll have regular normal rates for a healthy 65-year-old, regardless of their medical condition, which could be really only a couple of $100 a month or less.
Well, it's interesting. So there's a lot of the population that this Medicare would actually help.
Oh,
so
yes.
If I buy a medical supplement policy, does it cover my drugs too?
Medicare supplement policies do not cover prescription medications. So as I had said previously, if you do take option A, original Medicare, which is Part A and Part B, then you would have to take the standalone Medicare Part D plan. That would cover your prescription medications. But they're not really that expensive, and it's going to depend on your drug formulary. But so many of us take the standard medications for cholesterol, for high blood pressure, and those medications, by and large, they're usually tier 1 and tier 2 medications. And those typically come with $0 and maybe $5 copayments. But the short answer is yes, you would need a prescription drug plan if you took Medicare supplement.
So there's is there that donut hole in the
donut hole? That's the donut hole. So they were said to have gotten rid of the donut hole. What the donut hole basically is there's 3 drug phases. Basically, in a nutshell, once you and your plan has paid out just a little over $4,000, you go into this what they call you go to the catastrophic phase. Once you hit that catastrophic level, that's when you've actually paid, between you and your policy, you've paid out about $6,000, and then your cost for medications go way, way down. So here's the donut hole. It used to be that they would charge, it used to be 33%. Once you're in that highest bracket and you're paying the highest co-payments, used to be 33%. So what the government did is they knocked that down to 25%. So they never really got rid of that donut hole. They just reduced it from about 33% down to 25%. But as I said, and those are, typically if you're going to be in that donut hole, it's because you're taking those very expensive medications like the tier 3s, 4s, and 5s. But again, most people usually fall within that tier 1 and tier 2.
Okay, very good. So, all right, Gary, what's the difference between an HMO and a PPO?
HMO and a PPO, very common question. So an HMO, now when you talk about HMOs and PPO and you're talking about Medicare in the same breath, really, you're talking about a Medicare Advantage policy, okay? Because remember, Medicare supplements are completely different. So Medicare Advantage, you have a choice of like traditional under age 65 health insurance. You've got your choice. Do I want a HMO? Do I want a PPO? So the difference really is very simple. It's similar to your health insurance. With an HMO, you have to stay within the network. Okay, you can't, there's no out-of-network coverage. So you just want to make sure that your doctors and your specialists and your hospitals and urgent care centers, et cetera, you just want to make sure they're in that HMO network. When you take an HMO, your co-payments are typically going to be the lowest, okay? Because you're using this managed care network, and as a result, you get to benefit from very, very low costs, very low co-payments. Typically zero doctor co-payments, zero for us to see a specialist. It's typically 100% hospitalization versus a PPO, okay? The PPOs are going to have higher co-payments. Maybe it's zero to see a primary, but maybe it's 35 or 50 to see a specialist. Maybe there's a per day copayment in the hospital. And the reason why is with a PPO, you have number one, you have no referrals. So you can actually go out of network. So number one, no referrals. So if you want to go right to a specialist, you can go right to the specialist of your choice, as long as they're in the network. Okay. You can go out of network as well with a PPO. And then there's also another really great benefit with a PPO. If you travel a lot, a PPO may be a better choice for you because you have access to a national network.
So what you're telling me is with an HMO, the ducks have to line up in order is what they have to do.
Well, yes and no. I mean, it's a lot of people like the HMO because of the low costs. And, as long as the network is good, I mean, chances are your doctor's probably going to be in the network. And the other thing with an HMO is they do provide, if let's say you're out of state and God forbid, you have a medical emergency, your HMO is going to cover you no matter where you are in the country. In fact, some carriers even give you worldwide coverage for both urgent care and emergency care. Okay, so HMOs do provide that emergency care regardless of where you are. PPOs, on the other hand, let's say you're sick and you just want to go to a doctor. If you have a PPO and you're in California or Florida or New York, wherever you happen to be, as long as you're going to one of those doctors that are in that network, you can actually visit a doctor within that network throughout the entire country. That's the PPO.
So I'm going to put you on a spot in a couple ways. First of all, I want you to give our listeners, okay, the actual prefix for what an HMO is, and then I want you to follow up what a PPO is.
Okay, sure. That's okay. So an HMO stands for Health Maintenance Organization. And it's kind of the way the healthcare is delivered. And so you've got this health maintenance organization, you've got your patients and your clients using this network, this organization, right? This select group of people. And because they've chosen that HMO and they've chosen to work within that network of people, of professionals, they get the benefit of the lower costs, the lower copayments. Again, a PPO, on the other hand, it stands for Preferred Provider Organization. So a PPO is, again, it's a preferred provider, meaning that you can go to, let's say, a specialist that might be out of the network. So again, the preferred provider organizations, similar to the health maintenance organizations, it's basically just the way in which the healthcare is delivered to the consumer.
Okay, and then the follow up to that, which a lot of people are going to ask you, what's better, an HMO or a PPO? But
well, that is a great question. And the funny thing is probably half of my clients had HMOs and the other half had PPOs because, people that tend to not travel at all, they just kind of, stay in their kind of regional area, you're probably going to be, and provided your doctors are in the network, you're probably going to be better served with the HMO. Okay. If you're more active and let's say you travel, or let's say you visit, your relatives out of state, more frequently, then a PPO is going to serve you better, because remember, with the PPO, you've got access to that carrier's national network. So regardless of where you are in the country, you can go see a primary care physician. You can go see God forbid, if you have an ear issue, go see an ENT. Whatever the case may be, you've got access to that national network. Now, again, I'm going to come back to the HMO and say, remember that you still do have coverage with the HMO if you're out of state. If, God forbid, you have an emergency situation or even an urgent care situation, you'll still have coverage, even if you're out of your regional area.
Okay, but you say you have coverage, but when we talk about PPO, would you say you're less limited with a PPO than you are with an HMO?
It's actually the reverse. You're limited more with an HMO because you're confined to that network, right? Whereas the PPO, you have exposure to the carrier's national network,
Right.
all over the country. So you make a good point. But it's a very personal decision. But I would say the majority of the time, the people that pick the PPOs are people that do travel, right? Because they want to have access to the national network. And I've noticed that a lot of my people in healthcare profession tend to take the PPO. I think maybe perhaps they understand the value of the PPO in that they don't want to be limited to a network. They have a large network as a healthcare professional. They know a lot of people in the business, and maybe they're just more sensitive to having the freedom of choice that associated with a PPO. Because in that, again, with the HMO, it's a little more restricted.
Yeah, the one thing, folks, I want to emphasize, especially on all of our broadcasts here in the South Florida Tribune Network, is I want to make sure that you have a pen and paper. You're going to want to listen to these broadcasts a lot because you're not going to get it on the first listen. And when you're dealing with anything like health insurance, Medicare, and so forth, there is a lot to digest, and we're going to make sure that you get every last bit of that. So, folks, if you don't get it the first time, take notes, get that notepad. I don't care if it's a number 2 pencil or a black or blue pen. Get your notepad down out there because you got a lot of information about it. We want to make sure that we provide as much clarification on a subject that we're all probably going to have to deal with at some point in our lives, whether you're on Medicare earlier in the game due to disability or whether you're ultimately land on Medicare at the age of 65. So, Candy, why don't you talk about the Medicare Advantage plans in terms of the dental and the vision?
Or Scott, people could be looking for their parents or helping parents or other people that need help that might not have the knowledge to be able to digest all of this information too.
Exactly.
It's true. There's really a lot of moving parts to Medicare, and especially in the way it works with Medicaid. So that's another segment that we could always talk about. But many people qualify for Medicaid, and so you have a plan called a Medi plan. Medicaid, Medicare.
That's for another broadcast, Gary.
And that'll be for another broadcast. But again, I agreed. There's just a lot of moving parts to health insurance and Medicare. I try to make it simple.
Well,
so Gary,
so since 2 of us have glasses, okay, Candy, we'll segue over to the dental and the vision coverage.
I was just going to say, does Medicare Advantage plans offer dental and vision?
Medicare Advantage plans do offer those we call those ancillary coverages. So Medicare supplement plans do not. They just supplement your A and B. But yes, the answer is definite yes. Medicare Advantage plans, otherwise known as Part C, do typically have full dental. Not just, some plans have preventative dental, but then other plans have full dental. And then you have the vision coverage as well. And usually there's an amount that the carrier will credit toward your glasses or your contact lenses. Let me just back up real quick. Usually the dental coverage, it's not a lot of coverage. Usually carriers, I've seen them vary anywhere between $750 and $1,000 of benefit per calendar year for the dental. The vision, again, the carriers typically do give a, let's call it anywhere between, I've seen $200, it seems to be the average amount. And you can actually use that toward your lenses and frames, provided that you go to a participating eye doctor. So that's the vision. And then of course there's hearing benefits as well. So, and you can get quite a nice stipend toward that the carrier will pay you to offset the cost of those hearing aids. Typically I see $600 per ear or $1,200, usually every 2 years. So absolutely the Medicare Advantage plans, and that's why a lot of people like the Medicare Advantage, because it includes everything. It includes the medical, the dental, the vision, the hearing.
Gary, do you find that people that are aging now, that they don't have the same retirement benefits that they might be used to, that employers used to provide insurance longer going forward, and maybe now they're not covering these, and so you're finding more people need your coverage?
Interesting question. Yeah, I would say if anything, through the pandemic and just, overall, I think companies are looking to cut their costs. Every company is trying to be, pretty lean, especially nowadays. So I would say I'm sorry, I lost track.
So you're finding that your service is in more need now because less and less companies are keeping benefits for retirees and stuff like that.
Right. So I kind of got off on a tangent, but I would say, it really varies. So some people are coming from retiree benefits. Let's say like, I just recently spoke with somebody that retired from the New York Transit Authority and he moved here to Florida. He's got tremendous benefits. I think it's called GHI. You don't ever want to get rid of those benefits because you'll never get them back. And it's a tremendous supplement to their Medicare.
Mhm.
So I would say it really varies. If you have very good retiree benefits, usually that'll supplement your Medicare and you'll want to keep those retiree benefits. But then oftentimes I see people coming from, smaller companies that with lesser coverage. And in many cases, they're actually better off going on to Medicare. So it's really so individual. It really depends on, what they have and how much they're paying, the cost benefit formula. And then if I can improve upon their situation, that's what we're looking to do. So everybody has different needs. We look at everybody as individually and help and guide them into making the best decision.
Okay, Scott, I know you have something else left to ask, I think.
Yeah, well, I'm going to go take this dental and vision a little bit further than you did. Okay. When you talk about the dental and the vision, and I think that those are really minor health insurance type of things. Where do these Medicare compare to some of the vision and dental with regular insurance versus the Medicare?
Right. That's interesting, Scott. Yeah. So I would say that purchasing individual dental insurance is probably going to be a better choice. It's going to provide better coverage than the dental insurance that's offered on the Medicare Advantage. The problem is you don't really want duplicate coverage.
Right.
You don't really want to have to buy a separate, dental policy. I guess you could, but you really want to try to avoid that. Dental's a funny thing. It seems to be if you buy it outside of your Medicare Advantage plan, it seems to be kind of an expensive plan, and the coverage is somewhat limited. I sell dental insurance, and it can be a really great solution for a lot of folks, but not for everybody.
Okay.
But let me just the short answer is the difference between the dental offered at Medicare and purchasing it outside on your own, again, usually it's a little bit better outside when you're purchasing on your own. The reason why really is because you can buy plans that have a higher maximum benefit. Like remember, the Medicare Advantage plans maybe give you 1,000 of coverage, but if you purchase it outside, you may be able to get a policy that gives you, let's say, $3,000 worth of annual coverage.
Yeah, and that's what a lot of folks are gonna want to know about, how we compare and contrast the two. So I'm gonna throw another thing out there that a lot of folks have to deal with on a regular basis. We won't talk a lot about it. We're only gonna touch on this one, our discount medical plans, especially when it comes to other services like the dental and the vision and things like that. We know Medicare is a certain animal. We're not getting away from that. What we're talking about discounted medical plans, whether it's vision, whether it's prescriptions for that matter as well. So what are your thoughts of those?
You know, the most common discounted medical plans that I've seen that are not compliant with the Affordable Care Act, non-ACA compliant, really are policies that are offered by a lot of the different churches out there. Like I know the Mennonite Church offers a policy. I know a lot of the different churches offer these plans. They're really called share plans, and it's really not a traditional health insurance policy per se. Everybody kind of, you know, their premiums, I guess, go into a big pool, and that money is pulled out to cover claims. And it's not really the type of policy that I would recommend, although some people have told me it's worked out okay for them. But that's the most common, and of course they're not compliant with the ACA, the Affordable Care Act, so there's no subsidies available, so you would have to pay full price.
Well, the only reason why I'm bringing that up is, and I want to make sure we stay on point here with this, we're talking about discounting services for medicine, you know, prescriptions as well as vision. I don't want, and dental. I'm not taking it any further in terms of the Affordable Care Act. I want to talk about those other services that are, what do you call it, grocery list type of items, a la carte, whatever you call, and that's where we're keeping it in that context.
Gotcha. So one of those plans would be, let's say, GoodRx, right?
Right.
A lot of people, a lot of folks out there are using GoodRx, and GoodRx can be very helpful if you've got one of those higher, you know, cost medications like the tier 3s and 4s. The tier 5s are specialty meds, and those are extremely expensive. Usually you have to pay typically have to pay 33% of the cost of those medications. So they can be very pricey. But again, like the discounted plans that you're mentioning could be like a GoodRx. There are other companies too that offer these types of services where you can, let's say, pay an annual fee and then you get a discount on dental services, you know, medications and eyewear and things like that. But here's the thing. I don't think my clients need those types of plans. As long as I put them in a good comprehensive plan that's covering them, they shouldn't need to have to purchase those other benefits.
Well, we all know full well that the Medicare that you're going to get when you hit 65 is what it is. And of course, a lot of them require a prescription coverage as well. So I get that. And we're staying on point there. Those are just other things that people tend to think about, whether they think they want to add something else to reduce the cost of the vision, as well as the dental, as well as prescriptions. And one other point I want to talk about tonight is, how does the drug coverage differ from the supplement to the Medicare Advantage?
That's such a great question. I love that. So here's the thing. It's a really simple answer. A Part D plan is a Part D plan, regardless of the carrier. So which means whether you're buying a standalone Part D because you have a Medicare supplement plan and you need coverage for your prescription meds, or you're enrolling in a Medicare Advantage plan and you've already got the Part D in that Medicare Advantage plan, it's actually the same. It's subject to the same rules. The same donut hole applies to both plans. Again, a Part D is a Part D. The only difference really is if you're purchasing a Medicare supplement, you're going to have also another premium for your Part D. Okay, and again, that's going to vary based on your own personal drug formulary, what you take. Whereas with the Medicare Advantage, it's included in the Medicare Advantage plan at a zero plan premium, usually.
So Gary, can I ask you another follow-up question?
Sure.
when you're purchasing these, are these things you purchase on an annual basis? Or is it something that you purchase once and you're on that plan for years?
Okay, so really, it's both. You could purchase it once, let's say Medicare Advantage, and if you're happy with the plan, stay on it as long as you want. It'll automatically renew each year.
Okay,
So you don't have
Because
to do anything to like re-enroll if that's
okay.
what you're
Because I know
implying.
that there are some places, particularly, I mean, I'm talking from a little bit of experience. I normally help my dad, and I can't tell you which one he has, but I'm guessing because annually we look at his drug coverage and we redo drug coverage and which plan, because which plan will work better with the drugs that he takes.
Right. Okay. And some companies, um, some of the Medicare Advantage companies are a little bit more kind to, let's say, some of them have like an insulin savings program, because we know that insulin is very expensive. The Humalogs and Novalogs can be very, very costly. So a lot of folks are on that medication, but here's why that doesn't matter so much. If you saw the news, Walmart actually came out with their own brand of insulin, and I think it's only $4 for per dose. So it seems that now Walmart is getting involved in prescription medications. I think the whole prescription medication landscape is going to continue to change. Did I answer your question? Did you have any follow-up question to that?
No, I think it just depends on your plan, what suits you, if you need to revisit it every year.
Right. That's true. And let me just say this: in some respects, the drug coverage could be a little slightly better on the Medicare Advantage because of some of those insulin savings programs. But again, it's not as much of an issue now since, again, Walmart's offering their own brand for $4 per dose. It's less of an issue. And that seems to be some of the more expensive medications that people are taking. Just remember, again, it's free on the Medicare Advantage plan. You have to pay a monthly premium. So if I was to say, is there a drawback to having the standalone Medicare Advantage plan versus a standalone Part D plan versus your Medicare Part D on the Medicare Advantage? Even though it's the same plan, remember, there's a cost associated if you're purchasing the standalone Part D plan, whereas there's a zero cost on the Medicare Advantage plan.
All right, everybody. Just so you know,
Essentially, they're the same plans. Sorry.
you're listening to the South Florida Tribune podcast. My name is Scott Morgan, Rockport City Madmouth. Glad to be joined by Gary Kornbluh and Candy Ebling. We're talking about Medicare tonight, and we will be talking about Medicare for a long time, as well as regular health insurance as well. This broadcast is presented by Medigap X, is your source for Medicare and health insurance in Florida. Gary obviously has been doing this a long time, and he is your expert. And if you have any questions for Gary, you can always contact us at southfloridatribune@gmail.com, and we'll forward those questions over to Gary, and then he'll be able to get you answers as well. So good first act, Gary. Obviously, our folks, when you want to listen to this broadcast, I would encourage you to listen to it over and over. We make sure that there's a lot of information as well. Gary, before we end the broadcast, why don't you let everybody know how they can get a hold of you, and then we'll do it as well.
Okay, yes. Just call me. The best number to reach me at is my cell phone. It's always on 24/7. And that's 561-305-5949. Again, 561-305-5949. That's my cell. You can text me as well. And then my office number is 954-532-2060. And that's my office. My website, I'll give them my website because if they want to log on, they can see my Google reviews. I've got lots of 5-star reviews. So they can kind of browse, they can click the testimonials tab and then just see what a lot of my other clients have said about me. And that's www.medigapx.com. So www.medigapx, it's MEDIGAPX.com.
Okay, Candy, why don't you give everybody the South Florida Tribune information, please?
So everybody, if you're looking for more information, Gary's been writing us some articles. We have lots of good content. Come on over to www.southfloridatribune.com. You can see our broadcasts. You can see all the different contact we have, the content, I should say. You can see our contact information in case you want to see a different podcast, or you have an idea, you have an idea, you have questions for Gary, and maybe you have them and other people have them. So bring your ideas, let us know what what you want to listen to, what you want to hear. I know we have Facebook page, we have an Instagram page, we have Twitter. Scott, you can give us the Twitter handle.
And the Twitter handle is at Tribune South. It's at Tribune South. So please follow us there. And we, again, Candy talked about not only my personal Facebook page, Scott Morganroth with the South Florida Tribune as well. We do some with Instagram. And I, of course, you can connect with me on LinkedIn as well. So there's numerous ways to get a hold of us. This is the South Florida Tribune podcast. We have other shows I should make note for a moment too. The Sports Exchange, 108 Stitches, Baseball Talk, and No Limits. But Gary will be a regular on the South Florida Tribune podcast. We're going to be doing some in this format. We're going to be doing some on site as well. So we're going to keep it very real, and there's a lot of information. So meanwhile, this is Act One, guys. I appreciate you being on the broadcast tonight. So for Gary Kornbluh and Candy Ebling, my name is Scott Morganroth, the Motor City Madmouth. Thank you for joining us on this edition of the South Florida Tribune podcast. Until the next time. Meanwhile, folks, we want to make sure that you all have a great 4th of July weekend as well, and we'll catch you on the next episode. Good night, everybody.
Thanks for having me.
Right.